I'm going to talk about COVID-19 from the perspective of an ID physician. And here you can see, I'll be just showing you that it actually is a pandemic, and then we'll talk about the virus that causes COVID-19 and how it compares to other human coronaviruses, as well as how it compares to influenza. And then I'll go through a bit about the COVID-19 disease, the incubation period, the common symptoms, and then what are the risk factors for getting very sick from it, as well as how you can protect yourself. And finally, we'll end with talking about flattening the curve and how that affects the epidemic. So here you can see this is data from just about 2 days ago showing you the worldwide situation. And by definition, a pandemic is a new disease that is able to spread all over the world. So unfortunately, COVID-19 has made that a reality. And you can see now we're over 3 million cases. And I think you would know by now that that number is probably much lower and is actually, the real number is much higher, probably about 10 times higher than that, and as well as the deaths. And you can see from this map where the virus is mainly concentrated in right now, which is in the US, and then whereas Africa and Asia may be up and coming, but not hit so much yet. So in Singapore, unfortunately, our situation is we have an outbreak within an outbreak, and I would call this the third wave. So somehow it was overlooked, but the dorms became a huge hotspot. And it's not surprising because generally COVID-19 spreads in people who live very closely together. So it really shouldn't be any surprise. And unfortunately, the numbers in the dorms are very large in terms of how many people are living there. So that's really where the outbreak is. And that's where a lot of the medical attention is now going, rightfully so. So you can see we're now over 15,000 cases in Singapore, but the majority of them, about 13,000 at least by now, are due to the foreign dorm workers. Coronaviruses are not new to humans. There's not that many, but there have been 4 that have caused the common cold. And then more recently, you would have known about SARS, which happened about 11 years ago. And SARS was pretty severe. And if you look over here, it's a coronaviruses, which mainly come from bats. Bats are one of the oldest living mammals, and they carry a lot of coronaviruses. When SARS happened, they figured out that it was a SARS-CoV-1, which is now called SARS-CoV-1 because now we have 2. And the intermediate host was the civet cat. So it jumped from bats to the cat and then to humans through the wet markets in China. MERS then came along, and that's also a coronavirus coming from the bats. In that situation, the camel was the intermediate host, and that's why MERS is mainly seen in the Middle East, although you know a few years ago there was an outbreak in South Korea. And that was actually from a super spreader, and that's something we'll talk about that's common to all of these coronaviruses. So now we have SARS-CoV-2, which is the virus that causes COVID-19. And we're not sure yet what the intermediate host is. It's not the snake, it's probably the pangolin, but it hasn't been proven for sure. And when you look at compare SARS and MERS to COVID-19 so far, you can see that the mortality rate is highest with MERS, about 34%. It's really a very severe disease. Next is SARS, and compared to that, COVID-19, the mortality rate is actually right now about 2.5%, but that number is probably a lot lower. So just to remind you that coronaviruses are not new. There's 4 types that have been known to cause the common cold, and they cause about 1/3 of common colds in humans. And common colds, as you know, are more of just a nuisance. They don't really make anyone sick. They're more just a nuisance. But so COVID-19 or SARS-CoV-2 has some of the material of a coronavirus. So I think of it as kind of, you know, what you would get with the common cold, but then there's this SARS component as well. So you can see a whole spectrum of illness. And just to remind you, so 80% of patients just have very mild symptoms. And especially if you're young, it's basically like having a cold. 15% though can become moderately sick and require oxygen, and 5% become critical where they need to go to the ICU and actually often have other organs that may fail. And overall of the fatality rate is about 1 to 2%, as I mentioned. So I think of it sort of as the common cold that then merged with SARS, and you get the whole spectrum of disease, which is why it can be so scary. And not scary as well. If you're young, it's not scary. If you're old, you should be very scared. So the other comparison that I think is helpful to make is comparing COVID-19 with seasonal flu. So we're all familiar with the flu, and we know how that manifests, and usually we don't even worry about it enough that most people don't even take their flu shot, though they should. So just to compare, in terms of infectiousness, the RO number is one you might have seen. It just is a measure of how infectious is a virus, but it really does change based on your population. So if it's a new disease, the RO is going to be high because no one has ever seen the virus before. So we're all susceptible. And if you social distance, then the RO drops within that community because people aren't mingling and not spreading it as much. So the RO number, you should just realize that it does change based on the situation and whether it's a new disease or not. So for COVID, it's been about 2 to 2.5. You needed to get under 1 in order to really keep an epidemic stable, and much under 1 in order to stop it. So, so that's the infectiousness. Incubation period for flu is about 1 to 4 days, whereas for COVID, the problem is it's a bit longer. It goes up to 14 days, although 95% of people get sick within 11 days after exposure. And most people will get sick about 4 to 5 days after being exposed. The problem is that long incubation period. The hospital rate is much higher for COVID, but that's, again, probably because it's a new disease, and so we're more likely to get sick from it. So right now it's about 19%. In Singapore, of course, as you know, we're hospitalizing everyone, almost everyone, really just to make sure they're okay and to isolate. But so this 19% is not relevant for Singapore. The case fatality rate we'll talk more about, but for flu, it's quite low, it's 0.1%. But if you look at all the other complications that patients get from the flu, then it is a bit higher. For COVID, it's anywhere from 1 to 3.4%. And in Singapore, it's actually a lot lower. So how does flu compare to allergies and COVID-19? So the problem with COVID is, like I said, you can have very, very mild symptoms. And so you might be at home and you may not know, is this the flu or is it just allergies? So often in the beginning, you won't know. The fever is much more common with COVID-19 than with the flu. Flu, you can have fever as well, but allergies, you won't have a fever at all. And with the flu, if you're really sick, you'll have a fever, but often you won't. The problem with COVID-19 is the fever can happen later on the 3rd or 4th day. It may not happen initially. So you have to sort of watch yourself for a few days. Shortness of breath is something that also points more toward COVID-19 than the flu, whereas the cough, fatigue, weakness, and things are very similar between the two. The other things that have really been predictive in Singapore, especially for a patient developing COVID-19, is prolonged fever and then multiple visits to the GP. So if you feel sick enough to keep going to the GP, that's the trigger that you should worry about COVID-19. But if you're sneezing, having a runny nose, red eyes, or itchy eyes, that could be just allergies. So how does influenza compare to COVID-19 in terms of how it affects people? Well, one is both of them now we know cause asymptomatic and pre-symptomatic spread. So this is something we've known about influenza for a long time, that most of the time you are infectious and you give it to other people within the day before you really feel sick or the day that you really feel sick. And that's known as pre-symptomatic spread. In COVID-19, there is pre-symptomatic spread and there's also some asymptomatic spread, which is why we're all wearing masks now. They're both spread by droplet and fomites, which means droplets are the large droplets I'll show you a picture of. Fomite means that the virus also is contaminating the environment, and it can survive on surfaces for a while, as you've seen, anywhere from 24 to 72 hours unless you're cleaning well, which is why the cleaning has been stepped up on the MRT in public places. And certainly in our hospital. So droplet and fomite are the way it spreads, and it's similar to influenza, but that's why we say wash your hands well, don't put your hands in your eyes or your mouth, because you can give yourself the virus if you haven't washed your hands. So as a general rule, when you get home, the first thing you should do is wash your hands before you touch anything else. Both of them are more severe in the elderly, and they're also more severe in diabetics, as well as other chronic conditions. Interestingly, COVID-19 has not been shown to be very severe in pregnancy, which is good, whereas influenza pregnant women are more susceptible to getting severe influenza. Kids often transmit to adults when it comes to influenza, and vaccinating children has been shown to protect adults. So far in COVID-19, kids do not seem to be a major carrier of the disease, and they're not giving it to their parents. This is one of the reasons why Singapore didn't close the schools very early, because of this. And of course, we know for influenza, the vaccine is available. In fact, the new one has just come out for May, so you can go and get that. But for COVID-19, we don't have one yet. Now, just a little bit on pre-symptomatic transmission, because everyone wants to know about it. And why do we see it? Well, here you can see these are nasal swabs and the amount of virus that was detected. And this is days since the onset of symptoms. So here is day 0, and here would be like 18 days after you've been sick. And you can see that the graph, everything is on the downward trend. So the highest levels of virus are early on in your nose and in your throat, and that's why we tend to transmit it much more when right as we are getting sick or right before we get sick, and much later on we're not. Now in Singapore, as you all may have heard, we're doing these swabs and we don't let patients go home until 2 swabs are negative. And you can see from this that many times patients will have PCR positive swabs all the way in, for 20 days or even 30 days after they've been sick. So they end up being in isolation for a long time. We don't know for sure, and we don't think they're truly infectious. In fact, if you try to grow the virus, you can't really grow it after about day 9. But we're just being very cautious and not letting people go home because we don't want it to, spread. So what are the symptoms you should watch out for? Well, the ones that have really come out early with COVID are the loss of taste and loss of smell, which you've seen. Only about 30% or 40% of people experience that, but that can be a very early symptom or sign. And then, as I said, fever, fatigue, and dry cough are the most common symptoms. But because it's like the flu, you can get aches and pains, you can get headache, runny nose, sore throat, shortness of breath. And some patients mainly have diarrhea, so that can be a symptom along with fever. The elderly can also present with just some confusion, so that's something to look out for. In Singapore, most people will know they've been exposed or have been around someone who's had COVID, so it's not widespread right now in the community. So these are very non-specific symptoms, and if you have them and you've been exposed to someone, then that's when you really should worry. But of course, if you have prolonged fever and you're not getting better, you should get seen by the doctor for sure. So as I told you, 80% of people do fine with COVID, and 15% will get moderately sick, and then a smaller percentage will get really sick. So who are those patients? Well, older age is the biggest biomarker. So age is everything when it comes to COVID. And you can see here that if you're under 50, really you don't get very sick, or you may get sick, but you won't die from it. 50 to 59, it's starting to become a little bit higher of a mortality rate, but really it jumps up when you get to 70 and 80 and even above 60. So I would say older age above 60 has to be more careful. And the other risk factors are cardiovascular disease, high blood pressure, diabetes, of course, and then obesity. And I'll show you some of that in a minute. But first, I want to show you the mortality rates and how Singapore compares to the rest of the world. As you can see here, it's quite low, 0.1%. And Southeast Asia is fairly low, but once you get to the US and especially Europe, it's very high. A lot of that has to do with how much testing is going on. So if you are testing all your mild cases and all your really younger people, then your fatality rate will be much lower. So in countries like Spain and Italy that were overwhelmed, they were testing mainly the sick people who came to the hospital, who were the older ones. So that's why the rates are so much higher. In terms of Singapore's death rate, as you can see, no one under the age of 50 has died, and it's mainly, the majority have been 80 and above. So very much in keeping with older ages is the biggest risk factor. Now, this is data from China that shows fatality rate among those with prior medical conditions, and diabetes in their series is second. The first is cardiovascular disease, and then some of the other ones like hypertension and lung disease. Whereas this data is from the US, which is a very different population. This isn't mortality, it's just who was hospitalized, and it's broken down by age. So this first bar is 18 to 49, and this is 50 to 64 and above 65. So you can see here that high blood pressure was really the biggest risk factor for those that were older to get sick and be hospitalized. Whereas if you were younger and had obesity, that was a big risk factor. And I think that's the big difference between Asia, where we don't have such high obesity rates, that we're not seeing these younger sick patients. We're mainly seeing patients who have all the comorbidities like the hypertension and diabetes. Diabetes wasn't such a big risk factor. And to be honest, it's probably it's lower than hypertension and heart disease in terms of the risk of getting sick. So one of the questions that often gets asked is, should you stop taking your high blood pressure medicine, especially if it's an ACE inhibitor or what's called an ARB? And the answer is no, but the question comes up because SARS-CoV-2, just like SARS, binds to the ACE2 receptor. So SARS did the same thing, and that's how it enters into the cells through your nose or your mouth. However, just because that's the case, stopping your blood pressure medicine will not make you have less severe disease. And in fact, it's been shown now that that's not true. So the answer is no, do not stop your blood pressure medicine. Now, sometimes when patients get hospitalized, they do have some kidney injury and then it's held for that reason, but it's not being held because of the COVID. It's being held for other reasons. So please don't stop taking your blood pressure medicine. Now, how does COVID spread? As everyone knows, we've already talked about droplet, and the big question is it airborne? Can it be spread airborne? Generally, we still think the majority is droplet. The problem is that some people are called super spreaders, and some people, if you're singing or talking loud, you may force and send the droplets further than what we would normally consider. So if you have smaller infectious droplets or they get dried up and they're smaller, they may go further. So that is some of the confusion over this. And yes, there are some studies that show if you're sneezing, you may spread it further, and there could be some that lingers in the air, but that is really, it's not that easy to catch. And we know that because in Singapore, there's so much contact tracing going on. And if you look at the clusters, it's mainly people who've been living together, family members, or having, dinners and banquets or karaoke and things like that. So it's not so easy to catch whereas measles is very infectious, or chickenpox or TB. These are all airborne ones, whereas it's mainly still droplet or fomite. So don't forget the environmental contamination. That's definitely real as well. So if you look at our Singapore clusters, where everyone is being tracked, you can get a sense that it's mainly in people who are living in close quarters or have had prolonged contact through either banquets, singing, churches, mosques, things like that, work, places where you're at 8 hours a day with someone. It's really it's not spread very casually, is my point, which is why when we think about who we should avoid, everyone's worried about the grocery store and the MRT, but in fact, it's the socializing that's putting you more at risk. And that's why the government came down and said, no one meeting, just stay with your immediate family, because that is how it's being transmitted. And of course, as you can see in the dorms, people are living 10 to 15 in a room. So it's very easy for it to spread in that environment. So it's important to do social distancing. It's important to wear a mask to protect yourself and others, and then cleaning of the environment, because as I said, there's a lot of contamination and the virus can survive. So you do want to make sure you're cleaning routinely all your surfaces. So super spreaders, the biggest thing is, and this was true with SARS and MERS with the Korea outbreak, is that there are some people who are called super spreaders. We don't know who they are and we can't always predict it, but they tend to be the ones that are spreading it to a lot of people. So this was back in February, where there was a European who had come to the Hyatt for a conference, and then he went to the French Alps for skiing before he went back to the UK. And he had spread it to 19 people when they finally traced it all. And that would be considered a super spreader. So, and he never really got very sick from it. And that's the problem with super spreaders. They don't feel very sick, so they go out and then for some reason they are able to spew a lot of virus and spread it widely. So just to talk about flattening the curve, because everyone has heard about this, and this is why we're in lockdown. So flattening the curve is basically taking a regular, this is the curve, the first curve. I don't know, can you see my cursor? But the first curve in yellow is what the natural epidemic curve would be over time. So you would get a quick peak and then it would drop. And this is if you didn't do anything at all to stop the spread. So the problem with that is, in this horizontal orange dash line, is your health service capacity. How much can your hospitals handle? How much can your ICUs handle? So if you allow a new disease to just go unchecked, you'll get a very rapid peak and then it'll go away, but it'll overwhelm your ICUs and your hospitals. So the idea of flattening the curve is really just to give time to the city or the country to get ready for the cases. So you can never really cut out all the cases, but you can spread them out. So here you can see if you're flattening the curve, what you're doing is getting people to stay at home and you're spreading the cases over a longer period of time. And the hope is that by the end of it, or with more time, we'll have better treatments and we'll have vaccines. So the idea is to spread it out, prevent more infections until you're ready to take care of patients properly. And also your hospitals and ICUs don't get overwhelmed, so you can take care of people and you can support them, as has been shown in Singapore, where most of the time, even if you end up in the ICU, you do okay with a lot of medical support. So is the curve flattening for the countries? And the answer is yes. These are various countries. You can see the green is the US. So it's been flattening with all the social isolation that's going on, but then it will rise again. And that's what's happened in Spain and Italy and things. As they're opening up, you probably will get some peaks, but hopefully at that point, your hospitals can handle it. So one thing I want to point out, because everyone thinks about COVID, all we do is think about COVID. But what's interesting is in New York and in other places, and I'll show you the maps, there's actually excess deaths compared to the previous average from all the years before. Here you can see 2017 to 2019. This is how many people would be expected have died. And all of a sudden, from March to April, the number of deaths have really gone up in New York. And these are deaths not attributed to COVID. So there's excess deaths happening around the world. You can see the UK, France, Spain, the red line up here is how many more deaths there are compared to the year before, not due to COVID. So the question is, some of it may be missing COVID deaths, but the other thing that we worry about and that we wonder is, where have all the patients gone? Our emergency rooms are not getting the usual things that we get. And so the worry is that people are staying home. They're afraid to go to the hospital. They may have chest pain or weakness, signs of a stroke, and they're just so afraid to go to the hospital because of COVID that their other diseases aren't doing well, and people are dying for those reasons. So I just want to reassure you that all of our hospitals in Singapore, particularly the public ones, all of us have very safe emergency rooms and procedures for triaging patients. We have fever facilities, and so it is safe for you to go to the emergency room if you do have an emergency, or if you have something that you normally would go for. So for instance, a diabetic, ulcer that's getting worse, where you're having fevers, or you're having chest pain and shortness of breath, the hospital will be able to take care of you safely. We have dedicated isolation wards for COVID patients, and we make sure that the patients who don't have any symptoms of COVID are kept separately. So please don't be afraid to seek medical attention when you normally would, because we don't want to have excess, excess sickness or even death from patients who are afraid to come to the hospital. So my last few slides, one is on the vaccine. Everyone wants to know, are we going to get one? If we're going to get one, it will be true, but it'll be if they can figure out the science. So basically everyone is working on a vaccine that's set up to work on a vaccine. All the resources have been diverted to this. So just to show you this picture, this is the COVID virus. This is a schematic, but this is the receptor this is the part of the virus that grabs onto the cell receptor of the host. So our cell receptors. And the idea of a vaccine is to make an antibody that, or a protein that binds to this and then prevents the virus from attaching. So that's the best way a vaccine could work. And we don't know if an antibody will be protective in the long term. It may be like flu where you need to get it every year. We just don't know. But there's already vaccines in trials, and I think eventually we will have a vaccine, but it may not be for another year or so. Speaking of vaccines, please get your flu shot, because we do have a flu shot. It's not the best vaccine in the world, but it does prevent you from getting very sick from the flu. It may not prevent you from getting the flu, but you won't be as sick as you would have had you not gotten the vaccine. So just to end, I want to say that COVID has affected everyone, all of us. And this, I came across this, it was pretty interesting. There's a UAE Mars probe called HOPE that's supposed to be launched from Japan. And they had to go earlier to Japan because they would need to go into quarantine for 2 weeks before they could work on the probe there. So we're not the only ones who are affected. The whole world, including astronauts, are affected by quarantine measures. So in conclusion, please take care of your own health and seek care as usual. Don't let your, foot ulcers or your cough or even your, chest pain or anything get out of control. Please do seek help. And it is safe to go to the doctor and go to the hospital. So, and to summarize, COVID-19 can be mild to moderate. And of course, older age is who you need to worry about and protect, but also control your blood pressure. Heart disease is a risk factor. Obesity and diabetes, of course, can make it worse. And then the spread, remember, is mainly by close and prolonged contact. So it's hard because we worry more about strangers, but it's actually our closer friends, people we work with, that's where it's spreading. And then also the environment. So make sure you keep that clean and wash your hands frequently. And I like this comic because it says, of course he's home, he's a snail. So we should, for now, stay home and be safe and protect everyone until the government tells us we can go out again. Thank you.
Thank you, Dr. Samanis. I think all of you will agree that it's very important, especially with social media and WhatsApp, where we can get very disturbed and anxious about what we read. It's very important to hear a calming and sensible voice from an expert in the midst of this. And I hope that this will help you understand all that the government has implemented, put you in the right light of what you read, and to be able to differentiate what is true and what is not.